Is psychotherapy or medication more effective for treating anxiety? You might think the answer is straightforward, but there's a twist you won't see coming. Today, we're not only exploring the differences between these treatments, but I'll also reveal what I tell my patients when they come to me for concerns about anxiety. With anxiety disorders being the most common psychiatric disorder in the world, the impact of this discussion could be life-changing. The right choice could mean the difference between constant struggle and finding lasting relief. My promise to you, if you stick around for the full video, your understanding of anxiety treatments will greatly evolve. The more you learn today, the more empowered you'll be in making decisions that could dramatically alter your life. And who am I? My name is Dr. Sulman Aziz Mirza. I am triple board certified in adult psychiatry, child and adolescent psychiatry, and addiction medicine. And the answer to the age-old question, meds or therapy, is anxiety. It's a word we hear often, but what does it truly mean? Imagine standing on the stage at an underground rap battle. Your palms are sweaty, knees weak, arms are heavy, vomit on your sweater, mom's spaghetti. Yeah, I went there. That's the daily reality for millions. Anxiety isn't just a fleeting feeling, it's a persistent shadow that can darken every aspect of life. But here's where it gets complex. You're standing at this crossroads, faced with a crucial decision. Do you take the path of psychotherapy or the one leading to medication? You're about to choose a treatment, but a voice in your head whispers, what if this is the wrong decision? What if the other path was better? People want clear guidance, a roadmap to peace, yet the fear of making the wrong choice is paralyzing. There's anxiety about how to treat your anxiety. And cue the anxiety spiral. Now, let's add another layer, the stigma surrounding mental health treatment. It's like a heavy chain around the ankles of those seeking help. Imagine needing support but fearing judgment from others or even yourself. That same voice in your head says to you, meds are for people who are really messed up. And therapy? What would people think if I told them that I had to go to therapy? And what would I even talk about? And don't meds just mess people up even more? Guess who's back? The anxiety spiral. So, what should we do? Let's start with defining what therapy is. Psychotherapy, often known simply as therapy, might seem like a journey into the unknown. Picture a path winding through a dense forest, representing the complex landscape of our minds. But what really happens when someone steps into this path? In psychotherapy, it's not just about talking about your day. That would be chit-chatting. Therapy is a structured, strategic exploration guided by a trained professional. Imagine having a compass in this forest, one that helps navigate through the thickest underbrush of your thoughts and emotions. That's what a therapist does. They help chart a course through challenges, aiding in understanding and managing conditions like anxiety. Now, you might wonder, does this path really lead somewhere? The answer lies in the long-term benefits. It's not about quick fixes, it's about sustainable change. Anybody, even misogynists like Matt Walsh, can fire off a tweet where their best advice is to just stop making bad choices. Consider this, you're learning to navigate the forest, not just being carried out of it. This means acquiring skills and insights that stay with you long after the therapy sessions have ended, and more importantly, understanding why we make those quote-unquote bad choices. But here's a twist. Many worry about the commitment and the effectiveness of therapy. Will it be worth my time? Can talking truly heal? These are valid concerns. It's like standing at the edge of the forest, wondering if the journey through is worth it. Let me assure you, countless studies and success stories have shown that those who take the step often find themselves reaching clarity they never thought possible. But this sounds like a massive commitment, and how does this compare to medication? Is one path truly better than the other? Imagine you're facing an army, but this time the army is anxiety, and your shield is medication. But what exactly are these medications, and how do they work? This is where our journey takes a scientific turn. Among the ranks of these medications, you'll find names like SSRIs, SNRIs, and benzodiazepines. These aren't just random acronyms. They're keys to unlocking doors in our brains, doors that lead to relief. SSRIs, for example, increase the level of serotonin, a neurotransmitter that is hypothesized to help lift your mood and ease anxiety. It's like turning up the brightness in a dim room. Some common ones that you've probably heard of are things like Prozac, Zoloft, Lexapro, Cymbalta, Klonopin, and Xanax. Now, here's the issue many people face. the worry about side effects. Will these medications make me feel like a different person? Are they safe? Will they even work? It's a totally valid concern. Side effects can range from minimal to severe, but for many, the benefits far outweigh the risks. It's like choosing to wear armor in battle, knowing it might be heavy, but it'll protect you. The effectiveness of these treatments isn't just a claim, it's backed by research. Studies show that for many, medication can significantly reduce symptoms of anxiety. We're talking about real, measurable changes, not just anecdotal evidence. But how do you decide if this is the right path for you? How do these medications compare to the journey of psychotherapy? And what happens if you combine the two? Let's put psychotherapy and medication side by side, like two warriors preparing for battle. Each has its strengths, its weaknesses, and its ideal battlegrounds. On one side, psychotherapy offers a journey of self-discovery and skill building, effective in the long run by requiring time and commitment. On the other, medication can quickly fortify your defenses against anxiety, yet it may bring along allies you didn't ask for, side effects. The effectiveness of each method isn't a one-size-fits-all. It's tailored to the individual's battle with anxiety. But what if these two warriors join forces? This is where combination therapy enters the arena. A blend of psychotherapy and medication can sometimes be the ultimate strategy, offering both immediate relief and long-term resilience. It's like having both a shield and a sword in your arsenal. And the studies back this up. As while both therapy alone and medication alone can be helpful, the combination has almost always given better results. And remember, the ultimate goal isn't just to win the battle against anxiety, it's to achieve a state of equilibrium where anxiety no longer controls your life. This balance is the holy grail of mental health treatment, and it's within reach with the right approach. Yet, there's a dragon guarding this treasure, the cost and accessibility of treatment. Let's face it, the journey to mental well-being can be expensive. Psychotherapy sessions, medication prescriptions, the costs add up, and not everyone has a chest of gold to spend. But here's a ray of hope. There are more affordable and accessible paths emerging every day. From sliding scale fees for therapy to generic medication options, the landscape is changing. And let's not forget the map to these treasures, information on accessing mental health resources. Whether it's online platforms, community services, or support groups, the keys to the kingdom are out there, and there are more being added to the map every single day. So, when it comes down to it, which is the better choice for treating anxiety, medication or psychotherapy? The truth is, it depends. Mental health treatment is never a one-size-fits-all scenario. Each individual's journey with anxiety is unique, and so is the path to managing it. The decision should be a collaborative one, made together with your doctor, weighing all the factors and values to determine what's best for you. Remember, the goal is to find a treatment that aligns with your life, your needs, and your vision of wellness. Now, before we wrap up, I want to extend a special thank you to all of you for joining me on this journey today. If you found this video helpful, please consider liking and subscribing for more content like this. Your support means the world and helps guide others to these resources. And don't hesitate to share your thoughts and experiences in the comments below. Your story could be the beacon of hope for somebody else. And remember, you're not alone on this journey. Whether it's through these videos, your own research, or conversations with healthcare professionals like me, the path to managing anxiety is one that we walk together. Until next time, be safe and be well.